Hello, everybody. Thank you for giving me the opportunity to present our paper to you today. My name is Monirah, and we're going to discuss the national disparities in laparoscopic colorectal procedures for colon cancer. And we have no disclosures. As you know, the impact of race in determining the type of surgical care is still controversial. It has been discussed extensively in the literature, and yet the results are still contrasting. So the aim of our study is to answer the following questions. Does race has an effect on the use of laparoscopic surgery in colorectal cancer patients? And what are the independent predictors? And do predictors differ between patients with different racial backgrounds? Oh, sorry. So we did a cross-sectional study using the NIS data of 2009, and we included patients who were diagnosed primarily with colorectal cancer who underwent either laparoscopic or open colorectal procedure. Variables related to patients' demography and disease presentation, variables related to hospital characteristics were the study variables. So we pulled the data using the ICD-9 code for diagnosis and procedures, and then we categorized variables related to patients' demography and disease presentations. We test for the significant association with the laparoscopic procedure for each of the categorized variables, and then we adjust for them and look for other independent predictors among other study variables, so something related to type of admission and hospital characteristics. We did the last same step, but in each race group after treating the differences between race groups with a propensity score test. So we had 14,500 colorectal cancer patients. 32% had laparoscopic procedures. Most of them were Caucasian. Median age was 70. So to start to answer our first question, if you look at the laparoscopic procedure proportions among different racial backgrounds, you can see that the difference between them is not that statistically significant. We can see that laparoscopic proportion was more among patients presented with stage 1 disease, but gender didn't play a significant role in determining laparoscopic procedures. Insurance. So if you look at patients who were covered with the private and Medicare insurance plans, you can see that laparoscopic procedures are higher compared to patients covered with other type of insurance plans. So we tried to identify the reason behind that. We looked at the elective admission among different insurance groups that we have in this paper. So we had that Medicare and private have higher elective admissions. So this might explain why we have higher rates of laparoscopic procedures among Medicare and private that have higher rates of elective admissions. After adjusting for the previous variables, we tried to look at some predictors among variables related to admission type and hospital characteristics. So as you can see here, elective and urban and teaching hospitals located in the southern region have higher odds of undergoing laparoscopic procedures significantly. On the other hand, hospitals located in the Midwest has lower odds of undergoing the laparoscopic procedures. So we did the same last step in each race group, and you can see that the odds are almost universal and the predictors are almost universal among the Caucasian, African American, Hispanic, and Asian colorectal cancer patients. Except if you look at the last row where you can find the hospital location located in the western region, we can see that African American colorectal cancer patients and Asian patients have significant decrease in the odds of undergoing laparoscopic procedure if they were treated in the West compared to other racial backgrounds. So by that, we conclude that racial disparities in the likelihood of undergoing laparoscopic and open interventions are not found. Private and Medicare insurance plans are more likely to cover laparoscopic procedures. The predictors in the study were the teaching hospital status and urban settings, hospital location, the southern region, and elective procedures. Well, thank you.
questions or comments from the floor? So this is interesting that you found so little difference, really, because a lot of other analysis that have been done have shown a significant difference based on social status or insurance type.
Yeah, you're right. So maybe if you looked at the literature and compare the studies, and maybe this is best described by a systematic review published by Blaze and others. He reviewed papers published from 1980 until 2005. So we looked at the colorectal cancer as a model of healthcare disparities and found he mainly compared between African American and Caucasian mainly, and he looked at the difference in terms of disease presentation and demography and socioeconomic status and insurance, and then diagnosis and treatment for colorectal patients. So he found that if patients were equal, let's say, in the financial issues regarding the socioeconomic status or the insurance, and presented in the same stage, they will be offered the same treatment. But it's just sometimes they differ in their behavior. So they might. He found that some African American respond to the physicians less than the way the Caucasian respond. So is that related to the type of patient, or is it related to the physicians maybe and the way they explain the treatment plan to patients? But if you looked at papers published later than that, especially those using the population-based data, you can find that race is no longer a determining factor in choosing laparoscopic procedure or in determining surgical care in general, especially in colorectal cancer patients.
Right, and I think the other thing that's hard to get to sometimes in some of these database studies is that often the hospitals providing care at communities that are more financially deprived may have fewer academic surgeons, which fits in with the fact that you found higher rates at the university hospitals.
Yeah, you're
and
right.
That's hard to control for, and also the fact that often they just present with later disease, and that's a little harder to find when you're doing a population type analysis like this. John, any comments?
No, I think that was very good. I'd like to remind everybody that you can, up on the screen, if you want to text your questions to the magic screen here in front of Dr. Delaney, dial in the phone number and use the code 756 : that's punctuation mark : with your question, and it'll come right up here. And you can remain anonymous.
Absolutely. The new age. Thank you very much.
Thank you.